Hey, welcome back to my channel. I'll be talking about very important topic, and that is indications for statin therapy in prevention of ASCVD, atherosclerotic cardiovascular disease. Before moving to this topic, I'd like to first talk about the mechanism of action of statin. So it is actually HMG coenzyme A reductase inhibitor. This is the rate limiting enzyme in cholesterol synthesis. Okay, inhibitors. Okay, so what does statin do is actually statins decreases liver cholesterol. It also decreases mevalonic acid and increase HMG coenzyme A buildup in liver, and also increases LDL receptor expression, thus decreasing plasma LDL liver. It also has effect on VLDL. It actually decreases VLDL synthesis and thus decrease the level of triglyceride, but the more action is on LDL. So it also increases the LDL receptor expression and decreases LDL level in blood. Okay, now talking about the indications, the main topic for today. The indication of statins actually is divided into primary prevention and secondary prevention. So indication for statin therapy in prevention of ASCVD. So in talking about talking about primary prevention, it is recommended for primary prevention of ASCVD in patients with LDL more than equals to 190 mg per dl. For example, in cases of familial hypercholesterolemia, so statin therapy is indicated in those cases. Similarly, if the person is more than 40 or equal to 40 years of age with diabetes mellitus, regardless of the calculated ASCVD risks or regardless of the LDL level, will prescribe statin. So that is also primary prevention. These are the indications. Again, when suppose in cases of like several risk factors for atherosclerotic cardiovascular disease, like suppose smoking history, hyperlipidemia, male sex, where we in such patients what we do is we calculate 10-year ASCVD risks by using the pooled cohort equations, this cardiovascular risk calculator. And in that, if the result is suppose in between 7.5 to 10%, in that cases also what we have to do is those patients should be initiated on statin therapy for primary prevention of ASCVD. So there are three indications which is very high yield, and we must remember these indications. That is, one is LDL more than 190 mg per dl. The other one is more than equals to 40 with diabetes mellitus despite the level of LDL. And the other one is if there is estimated 10-year risks of ASCVD, that is atherosclerotic cardiovascular disease, in between 7.5, like more than 7.5 to 10%, then we need to also indicate for statin therapy in such cases. Now let's talk about secondary prevention. So if there is established ASCVD cases, like there is acute coronary syndrome, or there can be stable angina, or patient might have gone to the procedure like CAVG, the procedures like CAVG, then a patient might have stroke or TIA or even peripheral artery disease. In such cases also we need to prescribe or start statin therapy. Okay, and in these, which statin we use is like normally we use atorvastatin or rosuvastatin, and actually they are preferred. Why? Because they have relatively higher potency than other statins like simvastatin, pravastatin, statins. Okay, so mainly atorvastatin and rosuvastatin are the preferred statin we use. Now let's talk about, these are the high yield indication. I'll also add some side effects of statin that is very high yield to know. So what are these is, one is hepatotoxicity. It actually increases LFT levels, the transaminases. So in those person who have taken statin, we also need to look after the LFT functions. They get increased in statin therapy. The other one is myopathy, and this myopathy, especially when it is used with fibrates or even niacin, then we can see myopathy. The extreme one is rhabdomyolysis, which we should always check. Like we should always keep that thing in back of our mind, that with statin therapy the rhabdomyolysis can also occur. So that is one extreme risk factor, extreme side effects of statin therapy. The other one is, okay, what is the other one is, let me talk about this also. So I've talked about this. Let's talk about this rhabdomyolysis. I've talked. Okay, the one important thing is, even in cases of untreated hypothyroidism, like it can also increase the risk of statin myopathy. So if there is hypothyroidism, and we need to always look, because the hypothyroidism can also be associated with dyslipidemia. In those cases, the treatment like levothyroxine will be fine. But if that is not treated and then we are using statin, in those cases there is risk of statin myopathy as well. So we use high intensity statins in cases of, in the above one, like I talked about it earlier, atorvastatin, rosuvastatin. These are high intensity statin stock, and these are usually preferred because of relatively higher potency than other statins. So they also stabilize the atherosclerotic plaques and lower the risk of recurrent ACS. So that is also important. The other one is, other indication for statin is not about ASCVD. So patients with carotid atherosclerosis with asymptomatic and stenosis less than 50%. We are not talking about surgery here. So with stenosis less than 50%, we do not do revascularization. Instead, we go for intensive medical therapy, and that includes 3 drugs, and these are aspirin, antiplateletazine, statins we just talked about, and the other one is blood pressure control. We need to antihypertensive drugs. So this is all about indications for statin therapy in prevention of ASCVD. It is very high yield and easy to remember this. By knowing these points, these indications, it is easy to gain point on your exam day, one step closer to mass day. Thank you so much. Bye bye.